all of them are various types of blood cancers. The main difference between them is in the cell of origin. For example, leukemia arises from abnormal stem cells in the marrow, whereas myeloma arises from abnormal plasma cells also from the marrow, while lymphomas arises from abnormal white cells in the lymph nodes. The other major difference is in the type of chemotherapeutic agents used, because we do have to use different drugs for different types of cancers. But they all do respond quite well to treatment, and overall the prognosis is good. Again, it's going to be very difficult to pinpoint a specific cause for a particular patient. In general, the causes associated with the blood cancers includes viruses like Epstein-Barr virus, HIV virus, because all these have got to do with the immune system, and if there's immunodeficiency, lymphomas do arise. Other causes are like radiation, carcinogens, chemicals. These are the usual causes for blood cancers. For blood cancers, the common signs and symptoms are related to the problems arising from the three blood cells. In all these blood cancers, the white cells, the red cells, and the platelets are usually at very low levels. Let's say, for example, red cells. Usually that will be in anemia, and the patient will usually present with tiredness and lethargy. So if someone complains of being more tired than usual, they cannot do their 10-kilometer runs like usual, then they should seek attention. For platelets, the main manifestation is bleeding. And many of these patients with blood cancers can have nosebleeds, gum bleeding, or unusually heavy menstruation. For white cells, that usually manifests as frequent infections, frequent fevers that does not subside. And the other two common symptoms that comes together with all this is weight loss and loss of appetite. So if any patients have got any of these symptoms, they must seek medical attention. For us to make a diagnosis from the blood test or the so-called tumor markers, it must be pretty advanced stage. Very often the clinicians need to have a very high index of suspicion, and a good history taking, a good physical examination is still crucial to the diagnosis. Of course, these days we've got a lot more tools to help us. We can have specialized blood tests, we can have bone marrow examinations, we can have CT scans, and of course the PET scan. All these tools has allowed us to make diagnosis much earlier, and of course with an earlier diagnosis, treatment can be started earlier. That's why prognosis has increased. To get an accurate diagnosis, I think the best is still to do a full blood count and the ESR, because generally that would be enough to indicate whether one of these blood cancers is lurking in a person, right? Once the blood counts are back, it will give us a rough idea whether a PET scan will be needed, or bone marrow examination, or even more sophisticated tests like immunophenotyping to detect small monoclonal cells. These are the abnormal cancer cells. This can help us to detect small amounts of disease in the body. Looking at this slide here, right? If we see abnormal cells like this is very typical of a patient with leukemia. This is a leukemic blast. Whenever we see this is almost pathognomonic or almost diagnostic of someone with leukemia. So the blood test is a very important tool for us. The current treatments that are well proven are still good old chemotherapy, radiotherapy, and stem cell transplants. Chemotherapy, there are many more new drugs being discovered, and it has improved the chances of cure for many of these patients. Radiotherapy, in comparison, has been getting less and less useful So much so that we only use radiotherapy for very specific reasons, like for example in multiple myeloma, if it has affected a particular bone, then only we do radiotherapy. Stem cell transplant is the interesting one. It is not new, it's been around since the 1960s. But every 5 to 10 years, there are so many new advances that it's almost like a new treatment every 5 to 10 years, even though the name remains the same. For example, when it started in the late 1960s, stem cells were used from bone marrow, but now we can use stem cells from cord blood. We can use stem cells only from siblings in the past, but now we can use it from unrelated donors. And because of other advances in the HLA typing, antibiotics, growth factors, the chances of a cure has improved tremendously. The initial reports on bone marrow transplants, which is a form of stem cell transplants, when it was first done in the 1960s and 1970s, majority of patients die. It's the reverse now. It's the majority that will be cured of the disease. The only problem with that is you need to have a stem cell donor.